Sir, can you please tell us a bit about your journey?
For last, when I was in 12th standard, thought to become a doctor. And I got the admission in physical therapy from Pandit Deendayal Upadhyay Institute for Physically Handicapped.
What are some of the significant advancements you have seen in physical therapy during your career?
Physical therapy is a great branch. It's a prime healthcare professional. Finally, I find it out one of the promising branch to help lots of patients.
What physical therapy contribute in overall health and wellness beyond just treating the injuries or illnesses?
Specifically, if someone has the cervical pain, disc pain, low back pain.
सर, हम ये भी जानना चाहते हैं कि अत्यधिक परीक्षण बच्चों में चोटों को कैसे प्रभावित करता है और खेल खेलते समय बच्चों को चोटों से बचाने के लिए कौन-कौन सी सावधानियां बरतनी पड़ती है?
दिस इज वेरी वेरी इंपॉर्टेंट क्वेश्चन. ऐसे में सबसे इम्पोर्टेंट कोचेस का रोल है. ओवर ट्रेनिंग हमें रोकना होगा. बच्चों के फैटिग को, पेन को एनालाइज करना होगा. कई बार प्लेयर्स बोलते हैं कि हमें पेन हो रहा है, बट कोचेस आर नॉट टेकिंग इट सीरियसली. तो दे हैव टू टेक इट सीरियसली, देयर पेन को, स्वेलिंग को, टेंडरनेस को.
Welcome viewers, welcome to the MDPS podcast, a podcast from the students for the society. और आज के इस एपिसोड में हमारे साथ हैं डॉक्टर विभोर गोयल.
Today we are delighted to have Dr. Vibhor Goel with us. He is a senior consultant in physical therapy and has worked in both the USA and India. Dr. Goel has helped many people through his work in rehabilitation and sports medicine.
In this episode, we will talk about his journey, his work, and how he is making a difference in people's life. So, let's get started.
Thank you, children, and thank you to MDPS also for inviting me for this podcast. I'm grateful to you, and you can start with your questions. Maybe I could be great help for you.
Yes.
Yes, sir. Sir, can you please tell us a bit about your journey of physical therapy and what inspired you to pursue this field?
Actually, for last, when I was in 12th standard, I thought to become a doctor. And I got the admission in physical therapy from Pandit Deendayal Upadhyay Institute for Physically Handicapped. It is called IPH.
Okay.
This is one of the prime institute in India. And I got the admission. Finally, I did my bachelor's from there. Meanwhile, I practiced for a couple of years in India and went to America, United States of America. I pursued my MBA in healthcare administration from United States of America. And then I qualified for National Physical Therapy examination to work there in America. It's a license examination. It is a tough exam, but by God's grace, it was qualified.
Nice.
I worked there for few years, came back to India, and then I pursued my master's in physical therapy in sports medicine, another master's degree. I had the great interest in the sports medicine to treat the students, to treat the players who play sports. Okay. Then I am practicing right now in Delhi. I had my clinic here. Finally, I did my doctorate in physical therapy. I had a very specific interest in back injuries. My research in doctorate, in PhD, specifically is in back. There are low back injuries, disc pain. Basically, these are called disc pains.
Yes.
Okay. So I am working here now. Today I'm with you.
Yes, sir.
Nice.
So, the next question is to you is, what are some of the significant advancements you have seen in physical therapy during your career?
Physical therapy is a great branch. It's a prime healthcare profession, and finally I find it out one of the promising branch to help lots of patients, specifically in musculoskeletal injuries, neuromuscular problems, orthopedic problems, neurological problems, and you can go for gynecological problems. Many pediatric problems can be sorted out from there. So this is a lot of big branch. In fact, right now it is under booming state. Specifically, our main job is to treat the patient pre-operative rehabilitation,
Yes.
that is, and post-operative rehab, to help out many patients to treat pains, injuries, and surgical interventions post-operative, definitely. So we treat all the joints and muscles, that
Yes.
a lot of the things we do.
Yes, sir.
Yeah.
Yes, sir. What physical therapy contribute in overall health and wellness beyond just treating the injuries or illnesses?
Yeah, most important role in physical therapy to treat the injuries. This is a very
Yes,
important
sir.
question.
Yes, sir.
To treat the injuries, specifically if someone has the cervical pain, disc pain, low back pain. I have the specialization in the low back. I told you I did my
Yes,
PhD,
sir.
and discogenic pains, disc pains. Okay, ligament injuries, soft tissue injuries, and it's a wide branch. It can't be sorted out in one question. So medical science is categorized in many branches: orthopedic branch, neurology branch, medical sciences, gynecological branch, pediatric branch, sports injuries. So we have specific rules in all the branches to rehabilitate the patient. You know what is the meaning of rehabilitation? Rehabilitation means the patient who has some injury
Yes, sir.
prior to that injury, the patient is okay.
Yes.
Our main aim is to deal with the patient after injuries, that is to make the patient life as good as it was prior to injury. Okay.
Yes.
Yes, sir.
What are some common misconceptions about physical therapy which you would like to clarify?
There's not absolute too many misconceptions. Physical therapy is a separate entity in healthcare profession. So right now, awareness maybe in certain rural areas, people are not very much aware about it. But gradually, everybody is getting aware about physical therapy.
Yes.
As I told you, our main aim is to treat the injury. So our main aim is to treat the injuries. In that case, there's not too many misconceptions out of
Yes,
them.
Yes, sir.
The field is growing day by day, and government of India is supporting a lot
Yes,
to that
sir.
profession.
सर हम ये भी जानना चाहते हैं कि अत्यधिक परीक्षण बच्चों में चोटों को कैसे प्रभावित करता है और खेल खेलते समय बच्चों को चोटों से बचाने के लिए कौन-कौन सी सावधानियां बरतनी पड़ती है?
This is very important question.
Yes.
You mean अत्यधिक परीक्षण means you are talking about overtraining, right?
Yes,
Yes,
sir.
sir.
Overtraining. Many times I have seen in my career, children or sports person, they go for overtraining. अत्यधिक परीक्षण जिसे कहते हैं. ऐसे में सबसे इम्पोर्टेंट कोचेस का रोल है. ओवर ट्रेनिंग हमें रोकना होगा. बच्चों के फैटिक को, पेन को एनालाइज करना होगा.
Yes.
कई बार प्लेयर्स बोलते हैं कि हमें पेन हो रहा है, बट कोचेस आर नॉट टेकिंग इट सीरियसली. तो दे हैव टू टेक इट सीरियसली. देयर पेन को, स्वेलिंग को, टेंडरनेस को और फैटिक को. स्पेसिफिकली 12 ईयर्स से छोटे बच्चे, उनका रेस्ट पीरियड बहुत इंपॉर्टेंट है.
Yes, sir.
बहुत ज़्यादा ट्रेनिंग बियॉन्ड देयर कैपेबिलिटीज ऑलवेज रिजल्ट्स इन द इंजरीज. बेटा हमेशा ध्यान रखिए, जब भी कोई गेम खेल रहे हैं, अगर आपको नी में पेन है, बैक में पेन है, कहीं भी पेन होता है, डोंट ओवरलुक इट. इमीडिएटली टेल टू योर कोचेस, योर पेरेंट्स एंड टू योर डॉक्टर्स. ओके.
Yes.
और फिजिकल थेरेपी का बहुत इंपॉर्टेंट रोल है. कभी कोई पेन अगर होता है खेलते हुए, फॉरन आइस थेरेपी लगाइए, बर्फ लगाइए उस पर, एंड टॉक टू योर फिजिकल थेरेपिस्ट, जो स्पोर्ट्स फिजियो.
Yes.
ठीक है.
It also give relief.
इट आल्सो गिव्स रिलीफ. आइस से इन्फ्लेमेशन दूर होता है. एक इंपॉर्टेंट कंपोनेंट है मेडिकल साइंस में, राइस, RICE.
Yes.
You know
sir.
rice?
Yes, sir.
You heard about it? It's not chawal, it's rice,
Yes,
RICE.
yes, sir.
Rest. Tell me,
Yes, sir.
what is the complete form of rice?
It can be. I don't know like the pure meaning of it.
Okay, it's rice is rest, compression and elevation. बेटा ठीक है.
Compression.
कंप्रेस करके थोड़ा पैर को उठा लिया अगर पेन है तो. And be
Okay,
careful about severe injuries. If you overtraining may lead to severe injuries sometime. ग्रोथ प्लेट इंजरीज होती हैं. हमारे आपकी उम्र में क्या होता है, बच्चे ग्रोथ प्लेट जनरेट हो रही होती है. ग्रोथ प्लेट आमतौर पर हमारे रिस्ट में, एंकल में, नी में होती है. दीज आर द ग्रोथ प्लेट रीजन. अगर आपको लगातार रिपीटेड इंजरी होगा तो ग्रोथ प्लेट ज़्यादा डैमेज हो जाएगी बेटा. ठीक है. दैट इज रियली बिग प्रॉब्लम. तो उसे हमें डील करना पड़ता है, उसे एनालाइज करना पड़ता है. ठीक है. तो इमीडिएटली इफ़ यू हैव सीवियर पेन इन एनी ऑफ द एरिया, स्टॉप प्लेइंग, खेलना बंद कीजिए, रेस्ट कीजिए, आइस लगाइए, उस बर्फ लगाइए उस पर. रेस्ट, आइस, RICE इज कंप्रेशन, इज एलिवेशन. ठीक है. राइस का फुल फॉर्म ये है. रेस्ट, आराम कीजिए, बर्फ लगाइए, कंप्रेशन, थोड़ा पट्टी बांधिए उस पर फिगर ऑफ 8 में, एंड
sir.
पैर को एलिवेट कीजिए, एंड कंसल्ट योर डॉक्टर एंड फिजिकल थेरेपिस्ट. ठीक है.
Yes, sir.
Yes, sir.
So, how do you approach patient care, and what strategies do you use to build trust with your patient?
Better trust comes with the experience.
Yes, sir.
Yes,
If the patient is coming to me once, he may be somewhat confused. How is the
Yes,
doctor?
sir.
Yes, sir.
But your good behavior, honest behavior, and diagnosis,
Yes.
honest diagnosis helps to build up a trust.
Yes,
Yes,
sir.
sir.
When it helps to build up a trust, because it's a very noble profession. When you are working for the medical sciences,
Yes.
you are working in the health profession, somebody is coming to you with a great hope. And in my practice for last more than 20 years, I always tried never to break any hope of any of my patient. I never tell lies to my patients. We should be very much honest. Whatever
Yes,
we do,
sir.
we should be very much honest. But specifically in medical sciences, honesty is the one of the best policy, because we are not serving human beings, we are serving God.
Yes, sir.
Yes, sir.
Okay.
Are there any particular conditions or patients you are specialize in?
I'm a sports medicine rehab specialist.
Yes, sir.
I am dual. I told you I am dual masters. I did my MBA in healthcare administration. That is, I'm did my masters in business administration in healthcare and from United States of America. Then I did the masters in physical therapy in sports medicine. So I am a specialist in the sports medicine right now. And then did my doctorate. My research work was in the back injuries, back disc pain. Okay.
So how you did communications with your patient in critical medical informations, like when it is very hard to explain the patient what you are serving of, like that.
Yeah. Well. Okay. Intelligent question. Uh, it's not very much difficult to convince a patient. Everybody is intelligent. It's a today's era of it's era for internet era. Okay.
Yes, sir.
And everybody is well informed. I to tell you previously, be honest toward patients. If somebody came for the back pain, there, for example, if somebody comes to me for the back pain, uh, there are hundreds of diagnoses of back pain. I need to tell to the patient for what is the basic reason of back pain, right?
Yes, sir.
What is the basic cause of back pain? A patient has a back pain, it could be disc pain, it could be ligament pain, it could be muscular pain, it could be the postural pain, ligament
Yes,
pain,
sir.
muscular pain. So I need to differentiate it. It is called differential diagnosis.
Yes,
Yes,
sir.
On that basis, and this comes with the experience.
Hmm.
We can go for higher investigations also, X-rays, MRIs, CT scans, but pre- pre- prior to that, we need to go for clinical diagnosis. If your doctor is good enough, he can check you easily, and with our experience and with our education, we can easily judge it out what it could be.
Yes,
Then we
sir.
can correlate it with the investigations. Okay.
Yeah.
Yes, sir.
And we can tell to the patient what is the problem.
Yes.
Okay.
Yes, sir. Sir, we would like to know about most common physical issues you are seeing, especially post-pandemic.
Post pandemic,
Yes, sir.
most common physical issues post pandemic comes with the lungs problem. I have seen many patients who are suffering from pulmonary disorders, asthma, and sometimes infections in the lungs. They are very much prone for the infections in the lungs after COVID, post pandemic after COVID, and sometimes I've seeing the patients with the weakness, and joint pains are also common,
Yes, sir.
because they are dengue, COVID, and chikungunya.
Yes.
They all creates weakness in the joints and muscles also,
Yeah.
because this is the post pandemic effect.
Yes, sir.
Yes,
So
sir.
lungs problem and cardiac problem are common
Yes.
Yes, sir.
after post COVID.
So, what role do you think physical therapists should play in promoting preventions and wellness in the community?
Physical therapist, physical therapy branch. This branch usually believe in prevention of injuries. So because prevention is better than cure. I again
Yes,
repeat,
sir.
Vipita, always prevention is better than cure.
Yes, sir.
We tell our patients to take care of the posture, to do muscular strengthening exercises, to make the ligaments and other soft tissues supple, and I mean to maintain their vulnerability.
Yes, sir.
Yes, sir.
So this is important, number one. But if somebody comes for the injury, our main aim is to treat a patient conservatively. That is to help them with a conservative treatment, and up to the physical therapy is a branch that should be treated with international standards. Whatever
Yes,
in
sir.
Europe, in America, the advanced technology is used on the patients. They should also use in India.
Yes,
Yes,
sir.
Okay,
sir.
and where all the physical therapists are using it for the
Yes,
benefit of
sir.
patient.
Sir, what are some of the most effective techniques or modalities you have found in treating a person with musculoskeletal issues?
Okay, there are many modalities. First of all, we need to diagnose what is the cause of musculoskeletal problem. Okay, there are hundreds of causes. Differential diagnosis means we need to diagnose it differentially. What is the basic problem? Okay,
Yes,
when we
sir.
find out a problem, after then we have lots of we have main branches: electrotherapy branch, exercise therapy branch. Okay, we treat a patient with the electrotherapeutic approach. We have electrical stimulation programming. This is called NMES, interferential therapeutic approach. Then transcutaneous electric nerve stimulation, another equipment, and then ultrasound therapy, long wave radiation therapy, long wave therapy, and then short wave therapy. So we have lots of the equipments there to treat
Yes.
a patient. Laser beam and shock waves.
Yes, sir.
Shock
Yes,
waves.
sir.
There's many equipments are there.
So, how do you see the connection between physical health and mental health being in a person during your practices?
Whenever somebody is sick, the patient becomes scared.
Yes,
sir.
So
sir.
mental health is already affected.
Yes.
If I have some problem in my body, then definitely it affects on my psychological state also.
Yes, sir.
Okay.
Yes, sir.
So a healthy body gives you healthy mind, and healthy minds give you healthy body.
Yes,
Yes.
sir.
They both, the psychological state and physical state, they both are interlinked, bachcho.
Yes,
Yes,
sir.
sir.
Okay.
Sir, how individuals or children can take proactive steps to maintain their physical health and prevent themselves from illnesses or injuries?
Most important, diet,
Yes,
Yes, sir.
nutrition. You do not take breakfast. Your mom tells you, okay, take the breakfast, please, please, before going to school.
Yeah.
No, I'll take the lunch, please. I'm going, I'm running. Don't do that. Don't skip breakfast. Okay? It can ruin your health.
Yes.
Number one. Number second, vitamin deficiency are very much common now. Calcium deficiencies are very much common among kids, bacho. I tell you one thing. Last week I saw a 9 years old girl. She's studying in, I think, third or fourth standard. She had some problem in the knees. I find it out it was her rickets, and vitamin D was deficient. Her knees uh, was misaligned,
Yes.
so it was knock knee. Immediately I sent patient to the pediatrician, and we found a pediatrician, that is those who treat the children,
Yes,
Yes.
sir.
and I referred the case to pediatrician, and we found that her vitamin D was depleted. So treatment was started. So always consult your doctor regularly. Take proper vitamins, calcium with the consent of your physician. Okay.
Yes.
Yes, sir.
So giving the medications is very much important in the case of deficiency, but with the consent of your physician, not with the consent of physical therapist. Okay, physical therapist treat the patient with their technology. Okay,
Yes, sir.
to give the medications is the role of a pediatrician. Okay,
So, what are the biggest challenges in physical therapist and how do you refer it?
there are not very specific challenges. Medical field is interrelated.
Yes, sir.
If somebody is having orthopedic problem, I find it out. Okay, patient has a fracture.
Yes,
I need
sir.
to refer the case to orthopedic surgeon, because is their job. If there is some pediatric problem to a children,
Yes, sir.
to any child, then we refer the case to pediatrician. If I find, okay, the patient has back pain, but some lungs are also compromised, I need to refer the case to the chest physician.
Yes,
Yes,
sir.
So
sir.
everybody is interlinked.
Yes.
As
Yes,
soon
sir.
as any of medical professional find it out, the patient need physical therapy, they refer the case to physical therapy. Okay,
Yes,
this is
sir.
vice versa.
Yes.
Okay.
यस सर सर कोच और माता पिता छोटे खिलाड़ियों में चोट के प्रारंभिक लक्षणों को कैसे पहचान सकते हैं?
वेरी इंपॉर्टेंट क्वेश्चन. रिस्पॉन्सिबिलिटी जितनी भी है कोच और माता पिता की होती है,
यस
टीचर्स की होती है. ठीक है. अ, मुझे जो लगता है कि जैसे ही चोट लगता है, किसी बच्चे को चोट लगती है, सूजन पर, दर्द पर, और अपना कोई लिप करते हैं, आप लंगड़ा के चलते हैं, या कहीं भी चोट लगती है, तो उसमें जितना पेन हो रहा है उस पर फौरन ध्यान देना चाहिए. ठीक है. इमीडिएट डॉक्टर से कंसल्ट करना चाहिए, फिजिकल थेरेपी डॉक्टर से करना चाहिए आप लोगों को. जब आप इसे कंसल्ट करते हैं तो उस रिकवरी आसान हो जाएगा आपके लिए.
यस सर
चोट लगते हुए खेलना बिल्कुल कंटिन्यू मत कीजिए.
Yes.
कोई भी एक्सरसाइज नहीं करनी है चोट लगते हुए. ठीक है.
Yes. So, युवा पीढ़ियों में तनावपूर्ण स्थितियों में कैसे निपटा जाए?
रिलैक्सेशन, बॉडी एंड माइंड का रिलैक्सेशन.
यस सर
अगर तनाव आता है, सबसे इम्पोर्टेंट है डीप ब्रीदिंग एक्सरसाइज करो,
Yes, sir.
अपना ब्रेथ को अंदर लो, रोको थोड़ी देर के लिए, एक्सपायर करो उसको, आहिस्ता आहिस्ता मुंह से उसको एक्सपायर करो. आप एग्जाम दे रहे हो या कोई गेम खेल रहे हो, सबको तनाव होता है, मुझे भी होता है, सबको होता है, ठीक है. सबसे अच्छा तरीका है कि अपनी बॉडी को ढीला छोड़ दीजिए आप. योग वन ऑफ द गुड वे आउट है टू रिलीव एनी तनाव. किसी भी स्ट्रेस को दूर करने के लिए योगा हमारे पास बहुत इंपॉर्टेंट मेडिकल टूल है.
Yes, sir.
योगा करना शुरू करें, डीप ब्रीदिंग एक्सरसाइजेस करें, अनुलोम विलोम करें, ठीक है.
Yes,
इन
sir.
सब चीज़ों से आपको आराम मिलेगा काफ़ी. दूसरा, कुछ स्ट्रेचिंग एक्सरसाइजेज हैं, अपने कोच की देखरेख में वो सीखें, अपने फिजिकल थेरेपिस्ट से बात करें, वो आपको हेल्प करेंगे, जिससे आपके फिजिकल तनाव भी दूर होगा,
Yes,
ठीक है.
sir.
और तनाव लेना जरूरत क्या है, कोई तनाव नहीं लेना चाहिए, किस चीज़ का
Yes, sir.
तनाव, ठीक है.
Yes, sir.
क्योंकि आप बेस्ट हैं, बेस्ट परफॉर्म करेंगे तो बेस्ट रिजल्ट आएगा आपका,
Yes,
Yes,
sir.
sir.
ठीक है.
Sir, are there any innovative tools or treatments you are excited about?
Repeat your question.
Sir, are there any innovative tools or treatments you are excited about?
In my field, lots of innovations are done and they are already under process.
Yes, sir.
I personally feel this time within coming 10 years, we are heading towards robotic physical therapy. We are heading towards artificial intelligence physical therapy.
Yes,
Yes,
sir.
sir.
So the technology is advancing day by day.
Yes,
Yes,
sir.
sir.
Every 6 months, we are finding out new modalities in my field with upgradation, or they are yet to be come under latest innovative technologies.
Yes, sir. So, how to cure diseases or any sports injuries in teenagers under 16, and how you also cure them?
Okay, under 16 there are lots of injuries are there. I
Yes,
tell you
sir.
category wise. Important soft tissue injuries, ligament injuries.
Yes, sir.
If somebody is playing any game, knee ligament can be torn out. Then muscle strain, ligament sprain. Strain is called injury to muscle. I again repeat, beta. Strain is called ligament. Strain is called muscle injury.
Muscle.
Sprain is called ligament injury.
Yes.
Okay. So whenever there is a tear in the muscle or muscle is injured, it is called strain, and sprain is the terminology used for ligament tear. Okay.
Yes.
Yes, sir.
So soft tissue injuries, these are under soft tissue injuries. Then nerve injuries can be there, fractures can be there, dislocation can be there. Most common injury is compartment syndrome, that is shin pain.
Yes, sir.
I've seen many children below 16 years of age. They complain of shin pain. It is called compartment syndrome. Then you can find wrist injuries, especially musculoskeletal injuries. Okay, in contact sports like football and volleyball and
Yes, sir.
rugby. In these games, I have seen head injuries, concussion. This is serious. This is very much serious.
Yes.
If somebody suffers from any of the player suffers from head injury, immediately stop playing. Consult doctor immediately. It is
Yes,
very, very important.
Yes, sir.
I tell you one incident. Many years back, when you were not born, I was also a kid just like you.
Yes, sir.
There was a player, Raman Lamba. He suffered from head injury playing cricket, and he continued playing. Unfortunately, that was serious injury, and finally, it was lethal for him.
Yeah.
It is very, very sad case for Indian cricket, for Indian players.
Yes, sir.
So always be careful about head injuries,
Yes,
and
sir.
all the injuries can be treated well. Nothing to worry about it, but we need to take the precautions.
Yes, sir.
Yes.
We should be careful
Yes,
playing
sir.
games. Okay.
The preventive cures.
Preventive cures, and the coaches should provide you preventive
Yes,
equipment
sir.
like helmets, knee guards
Yes.
when these contact sports are there, and if there are any chance of injury. Playground should be neat and clean. It should
Yes,
not be
sir.
wet. Playground should not wet.
Yes, sir.
After rainy seasons, you should not play game because there are very much chances of to get slipped down. Okay,
Yes, sir.
Yes, sir.
so be careful about it.
So, because preventive measures are very good than the curative measures.
Preventive
Yeah.
measures are always good than curative
Yes,
measures.
sir.
Why
Yes,
to
sir.
why to fall sick?
Yes,
Yeah.
sir. We
Nobody
can,
wants to fall sick.
we can do the precautions.
We can do the precautions. We can
Yes.
take precautions,
We
of
can
course.
take care of ourselves.
We should take care of ourselves. But even then, if there is injury, then doctors are there to help you.
Yes,
sir.
sir.
Okay.
Sir, at the end, I would like you to give advices to the individuals who are considering their career in physical therapy.
Yeah, physical therapy is a great branch for to be a physical therapist. You need to take physics, chemistry, biology
Yes,
sir.
in 11th and 12th standard.
Yes, sir.
Then you need to take entrance examination to get in National Institute.
Yes,
Okay.
sir.
Then after four and a half to 5.5 years of degree or 5 years of degree, will get the bachelor's in physical therapy degree (BPT),
Yes.
and after then you can go for specialization. Just I did my master's in sports medicine. You
Yeah.
can go for doctorate. You can open your clinic. You can do jobs in hospital, and it's okay.
Yes,
Yes,
sir.
sir.
Thank you, sir, for giving your precious time to us by being here and sharing your valuable thoughts as well as experiences.
I am also very much happy talking to you.
Thank you,
Thank
sir.
you so much,
Thank you,
sir.
and you are most welcome. God bless both of you.
Thank you, sir.
That is all for today. Stay safe and stay healthy.